Ketamine infusion therapy is an exciting, innovative treatment that can help with everything from chronic pain to depression. The team at Baltimore Ketamine Clinic offers this cutting-edge therapy in a caring and professional environment. And here to tell us more about it are Ivana Mitic and Margaret Rajnik of the Baltimore Ketamine Clinic. Ladies, welcome.
Thank you.
Thank you.
So tell me, how did you come up with the idea to start this clinic?
So first, Elsa, thank you so much for having us on your show. As a nurse anesthesiologist, I have anesthetized thousands of patients for surgeries over the years, and many of them were really tolerant to opiates. So the only medication that would help them was ketamine. And as I learned more about ketamine use for anxiety and depression, I felt really passionate about bringing the service to our community. I had lost 2 dear friends to suicide over the last couple of years, so this was something really dear and special to me.
And so you decided to bring it to the entire community. It touched you personally. For people who are watching and they don't really know what ketamine is, it's new for me too. What exactly is it and what conditions can it treat?
So ketamine is an anesthetic medication, and when it's used in low doses, it really helps decrease the symptoms of chronic pain, fibromyalgia, migraines, Lyme's disease, as well as anxiety, depression, PTSD. And the one that's really big and important is postpartum depression. So can you imagine how amazing it is when a mom who has suffered from postpartum depression finally gets relief, you know, within really short period of time, and she can finally bond with her baby. Or if somebody is suicidal and they get relief quickly and they realize there is hope for them. So we have also seen many of our pain patients get really significant pain relief, and their quality of life is greatly improved.
It touches so many people, can be used for so many different reasons. If someone is watching and they think, you know what, I think this might help with my chronic pain, it might help with my depression, what are the next steps that they take?
They would call our clinic, and they would also go online, so we have access through online capacity. And then they would come in and do a physical exam with me, and I would review their records from all their subspecialists or possibly from their psychiatrist and their therapist, so to see if they meet the criteria. Once that's done, then we start to evaluate what type of treatment do they need. Do they need treatment for anxiety and depression? Do they need treatment for chronic regional pain? And then those treatments are set up in different avenues of success for them.
So you go through the whole process, you diagnose it individually. So this isn't a one-size-fits-all treatment plan.
No, I mean, you really have to look at the individual and see what treatments they've been on, how much success they've had in the past, and how does it affect them, and really, is this the best alternative for them? And that is by reviewing records and having consultation with other subspecialists.
And how is it for you two, as medical professionals, to be delivering this service, which is new to the area, and to actually see the impact firsthand with your patients?
It's been really, really life-changing. As we see their lives change, you know, they're changing us as well, because things that never worked and, you know, were impossible for them, we're making it possible.
And you touched on this too. I mean, with the opioid epidemic that we're seeing, this is a safer alternative, that you don't have to get medications that could potentially become addictive. This is something that you can do in a safe environment, a caring environment. Talk about the clinic itself. It really does look like a spa almost. It looks
we like
really
that
nice.
Approach.
Yeah.
So yes, we really wanted to make it not hospital-like, not sterile, very welcoming, with different lights, different colors, where people will really feel safe and welcome.
Yes.
Many of those patients have really suffered, even through the hospitals. A lot of them are really misjudged because of their pain. So when they come in to us, we really want them to feel comfortable and that they will really be taken care of.
A safe and welcoming environment.
Absolutely.
Anything else that you want to tell me that maybe I'm missing?
I just think that it's a new wave of being able to care for individuals and helping them achieve success. Their outcomes are beautiful. The way we follow them is different than in a regular setting. We look at data daily and help them achieve great success, and the families are very happy.
Well, we've got some information on our screen. Thank you so much for joining us. You can get 50% off of that initial exam. They're located right in Timonium. Just call the number on your screen. Otherwise, go to BaltimoreKetamineClinic.com. Thank you so much for joining us.
Thank you.
And we'll be right back right after this. Stay tuned.